Hi, guys. Welcome back to Previa podcast. This is Sarah, and I'm joined by Whitney and a very special guest today, Lisa McCarty. She is a fan favorite of ours and a fellow mom, and we're so excited to welcome you, Lisa, and hear your story. So, welcome to Previa podcast.
Thank you so much for having me.
So, tell our listeners who don't know you how we've got to know you in your story, just a little bit about you, and then we'll kind of dive into, I think, a really important message, which is your story and what you're advocating for moms.
Sure. So my name is Lisa, and I am a writer, a women's health advocate, and a mom. Not last but not least. And I have two kids. I actually conceived via IVF. I went through years of infertility and became a women's health advocate over the last couple of years because it's really important for me to not only share my story to help others feel less alone, but also to advocate for decreasing the stigma around infertility and raising awareness on this common problem that affects millions of women.
And it is so common. Me and Whitney both have experienced the journey of infertility in different routes and the shame and the stigma we've talked about, and just feeling like, I mean, I think there's nothing worse when you're going through it and you're
Yeah.
secretly crying when you get your period and you thought, well, it could be this month. And then
Yeah.
you open your phone and you're seeing gazillions of baby announcements, especially around the holidays, right? It's just
Yeah.
like, is anybody and their brother not pregnant?
Yeah.
Or
So triggering for sure.
it's really
It is.
hard. You want to be happy for them, but like you're holding this in and you just go like, what's wrong with me? So
Yeah.
we always welcome these conversations because you're very valid, and the point is like women need to know they're not alone on this. This is very common, and what you're feeling and saying, to hear someone else join in and say me too, there's so much
Yeah.
power in that.
There really is. And I would say also that at the beginning of my journey, I didn't have the support because I feel like, Instagram didn't exist. I'm not going to say my age to date myself, but, it was a while ago. And our journey was close to 10 years on and off. So I didn't have access to that support until late in my journey. So it was, like basically the second time we started IVF again. So I think to your point, there is a lot of power and support and community. And the biggest piece I've learned along the way is that hearing someone else validate and say, I see you, I know what you're going through, I empathize with you, that empathy sort of creates that validation within you to say, oh my gosh, somebody understands without me explaining. And I think that's really powerful.
So let's walk us through. So you get married, you're like, let's, we all, I think me and Whitney said this before. We just
Yeah.
thought you got married and pregnancy just happens, right? Like in the movies, like in a Disney
Right.
movie. Oh, we're
Yes.
just gonna
Like
get
every
pregnant.
rom-com, we just, like it's
Uh-huh.
just how it works. Or oops, I'm pregnant, the
Uh-huh.
accident, which, I think we all, anyone who has gone through infertility and, you guys have, so you can understand this better than anybody. When you have gone through that, prior to the experience, you think sort of like that misconception in your mind, it's going to be easy, just like everyone else. And then it's like, nope, that's
Just
not at all
kidding.
what our experience is going to be like. So it's
Totally.
challenging for sure. So my husband and I got married, and the funny thing was that I look at sort of as a funny moment because I think to myself, my period stopped for a few years, and I thought, wow, I'm really lucky. Like, this is going to be fantastic. I don't have to deal with this because of the headaches and the cramps and all the things. At that time, I didn't want to become a mom. So, you spend the first half of your life, like many women, trying not to get pregnant. And then the second half of your life, trying to get pregnant in some cases. So, in a nutshell, my periods had stopped. I went in to see the OB. They referred me to an endocrinologist, to which I'm thinking, like, why do I need to see someone about this? Why can't you just, snap your fingers or give me some magical pill to like fix it? But that's just, not at all how our experience was. So yeah, so essentially we met with the endocrinologist. It took a few months to get an appointment. And then we sat down and talked about all the factors in my situation. I had a period for a long time, and then it sort of just abruptly stopped. He initially diagnosed me with postamenorrhea, which is when, in some cases, being on the birth control pill for a long period of time can result in a lack of period for 6 months or longer. And for me, it was like close to 3 years that I didn't have a period. So like the day we got married, I still remember this vividly, that like I didn't have a period. So like I didn't have to worry about anything, like I'm
Yeah.
wearing all white, it was sort of like just ironic. But anyway, so we basically started treatment. We did a couple rounds of IUI, ended up had all negative cycles, no losses initially. And then we started IVF, and we actually got pregnant with our first IVF transfer, which was my daughter, who is now just turned 11. I don't know how that happened, but flash forward. And then we kind of paused, and, I'm enjoying motherhood. And then we basically went back into treatment again because I knew that I wasn't able to, like, my cycle hadn't resumed on its own. So essentially, I was actually diagnosed with PCOS at that point because I was overstimulating with the medication. Actually, I'll back up a second. So right before we did the transfer for my daughter, we were originally planning to a fresh transfer. And that actually, I ended up overstimulating. I ended up in the hospital with a suspected DVT, which is, when your legs are swelling up and there's potential blood clot in your leg. And so luckily it ended up being negative. So I was grateful for that, but induced, a panic attack, and all of the anxiety came to surface for that. So anyway, we did a frozen transfer for her, and then obviously it was successful and we had her. So we waited a couple years. We started transfers again. I had some remaining embryos, and those all were negative cycles. It was just like, nothing was happening, which I think, again, I had that misconception that it would be easy because I was able to successfully get pregnant with IVF the first time. I thought, okay, we figured it out. I've overcome infertility. It's going to be great. No, it was like the opposite. So I actually wrote an essay about this in HuffPost recently. You guys might have seen that. Essentially, the path was using the remaining embryos, and then we ended up doing another egg retrieval, and we were able to yield 7 more embryos. So we did a total of 14 transfers. Right before the last transfer, I had essentially had 4 losses in a row. And it's crazy to me that it took us a year to get diagnosed, because my doctor didn't even talk to me about the potential of a condition called Asherman syndrome. Have you guys talked about that? I wasn't sure if you guys
We
have
have
talked.
not. And I read your article,
Yeah,
and so I was at risk for Asherman syndrome myself because I had our first pregnancy was a miscarriage. I had to have a D&C. I had a
right.
septate uterus. So essentially, my uterus had this bunch of just like tissue that was supposed to
Yeah.
have evolved and moved away in the womb, never did. And so Ava, who I talk about, she was our first pregnancy. I lost her at 13 weeks. She had implanted on my septum in my uterus, and they had not caught that. And clearly there's no blood flow to the septum. So
Yeah.
essentially she was not viable from that. But I could not pass her in my miscarriage because of that septum. So they had to go in with the D&C,
Right.
and it was a pretty aggressive D&C. So for our listeners, the D&C is basically when they have to go in surgically and they have to remove the sac or the fetus once the baby has passed, because you cannot safely pass that in a miscarriage. And then I had to have 2 more surgeries from my septum. So I had a lot of scar tissue.
Yeah.
And they told me, they said, you may be at risk for Asherman syndrome. And I was like, what is that? Like,
Yeah,
through nursing school,
exactly.
I was
And I
like,
didn't
no
know
one
what
ever
it
told
was
me that.
either.
And my husband, he's a physician, and he was in actually radiology residency at the time. And he was like, oh, I hope you don't have that. And I'm
Yeah.
like, well, that's comforting.
Right.
I'm just like,
Very
well, that's,
You're like,
reassuring.
me
you know,
too.
me too. And he is like, it is very hard to diagnose. I remember him specifically saying that. So when I was reading your story, because it is repeated losses
Yeah.
and is a big sign from that. But I know from my experience, with our first loss, our first miscarriage, I was very dismissed from, and I had to end up switching OBs. They said, well, you're young. It happens.
Yeah.
And I read it in your article. You said in your gut, you knew
Yes.
something was wrong. And
Yeah.
I felt that in my gut. I was
Yeah.
like, nope, this is more than that.
Yeah.
And
So
they're
often
like,
we
no,
trust our doctors because we feel that they are the medical experts. They're the ones that have that training to tell us what's wrong. But in actuality, I believe, not only as an advocate, but as a woman and someone who's been through a lot of this, decision point, that crossroads where you have to decide with what your gut says and what the doctor says. And if they don't sync up, you have to make a decision. Am I going to go with what my gut says and get a second opinion? Or am I going to continue on this path and follow and trust my doctor, which of course we always want to trust our practitioner, but in some cases the gut is the answer. And so, yeah, I'm so sorry for your loss. I didn't know that happened.
I'm a lot more comfortable speaking about it now. And I say this to a lot of moms. I'm just like, when we talk about miscarriage and recurrent loss, there is some kind of horrible standard out there, like it's just okay. And I thought to myself, if I didn't follow my gut, how many losses would I've had to endure? And I've heard of women say, oh, they said you have to have 3 losses before I do anything else, or I miscarried 12 times, Sarah, before someone would listen to me,
Oh
or
my
I
gosh.
found a
Yeah.
doctor. So I hear these stories, and I think it's very invalidating, and a loss is a loss. And the whole process of healing that, and not only on your body, but mentally, that's trauma. I mean, Whitney
Absolutely.
sees several
Yeah.
patients that we know that they're having these losses, and the postpartum depression and postpartum anxiety and our mental health is very much a complication, just like it would a full term pregnancy and birth.
Yes, definitely. And I would also say that the part that isn't as communicated by OBs and other medical practitioners, that maybe your providers like an endocrinologist or OBGYN or gynecological surgeon, they would be the ones probably to say it. But in most cases, a general doctor isn't going to tell you about Asherman's. This is unfortunate. Like, it seems to be the case in many women that I've talked to and medical studies that I've read, that Asherman's is just not communicated that much. And then the second piece of that is that DNC, C-section, ovarian cancer, miscarriage, recurrent miscarriage, those are all trauma to the uterus. And unfortunately, they raise your risk for Asherman syndrome. And that's also the part that I didn't know. So I actually have had 2 DNCs. One was just after my daughter was born, because the placenta wouldn't come out. I had a retained placenta, which was another complication and another trauma. And so that caused trauma to the uterus, and they ended up doing an emergency DNC. So then fast forward to the 4 losses, my second time going through IVF for almost 4 years, I basically had to have one of those was DNC. And then I actually ended up having an emergency DNC after my son 1 week postpartum. Yeah, which was another trauma. And I think in general, the body, women's bodies are incredible that we can make a child in the first place and endure years of infertility and all this trauma. I think the real takeaway is, though, that like following that intuition and that gut feeling, but also knowing your body. So like you said, if you notice that there is a change in your pain, for example, in a couple of the cases, like I noticed that pain or the bleeding started before they even told me that it was a loss. I mean, pay attention to that sort of natural feeling, like how do you feel normally? And then if there is a change or impact on your quality of life, like your pain is that high, like talk to your doctor. And if you don't feel like you're being listened to, then raise that with another doctor, get a second opinion. Absolutely. I mean, we have to be our own best advocates in everything, especially when it comes to our health as women.
Totally. No, I mean, I think if you even look at, I've harped on this because so I remember, so I had to have an HSG, which I'm sure you did as well.
Multiple, yes.
It was I remember I had no clue. And I remember asking my husband, I was like, 'cause he went in training, he was like reading them, perform them. And clearly I was like, oh, is this gonna be bad? And he was like, I really don't know, because he's like, I've never experienced it.
Right.
He's like, some women seem to tolerate it okay. And I looked at the nurse right before, I never forget this. And I was changing into your little gown, and that's just like the fact, like, let's just even say
Yeah.
that changing, getting naked and putting on this little
Right.
hospital
Yes.
gown.
I
You're in a
remember that so
scary
vividly.
OR
Yes.
room. Like, that's super
It's
uncomfortable.
so
It's
awkward.
anxiety.
Yeah.
It's so awkward. And then they're gonna insert a speculum and insert this thing upside you and shoot dye. And it And you know this is going to happen, right? And there's the doctors there to read the scan. But I remember looking at her,
Yeah.
I said, "Is this going to hurt?" And she goes, "It's going to go quick." And I thought, oh my
Yeah.
God.
On what on what planet is that reassuring? That
And then it's like they gave me a leave. And I'm like,
I
Mhm.
feel like
that
they
was
should
very like,
advise you ahead of time, right? Because I don't
oh
remember
my
that.
God. No, they
Because I
did
think
not
I
tell me.
had multiple HSGs and I
Right.
recall them all being uncomfortable. Not to
Yeah.
scare
Super
anyone that's
uncomfortable.
listening, I would just
Yeah.
say talk to your doctor in advance and ask if you
Right.
should take something, even if it's just
Mhm.
like
Yeah.
a Tylenol, because I don't know if you can
Mhm.
do an anti-inflammatory like in a leave if there is
Because the
bleeding,
bleeding.
potentially could increase the
Yeah.
bleeding,
They didn't
but
say
that you have to
anything
do that.
beforehand to me. And I was just like, wow. And then I talked to one of my friends and they're
Yeah.
like, oh, no, they did it under anesthesia in Texas. And I was like, what?
Under
I
oh my gosh.
literally got like over the
Wow.
counter meds and I went back to work that day. But if you think
Wow.
about what they give men for a vasectomy, right?
Yeah.
They give them all this
Right.
pain medication. And for here for us, they're just like, good luck
Well,
with
because
your
our
Tylenol.
pain threshold is much higher, don't you think? I
It
feel
Truly.
like
is.
as women, we are built to withstand any level of pain, I feel like. But we also speak up, I feel like, better than generally men do. But I
Yeah.
do feel like there's probably like that. Years ago, there was a viral video from a mom blogger. I can't remember her name at the moment, but it was like the man cold. Do you remember
Yes.
that?
Yes.
The
Where we
man's
like went
voice.
Yes.
around and it was
Mhm.
it was like when the wife or the mom is sick, nothing stops. You still have to do the job of taking care of everyone because we don't
Right.
get sick days, right? And then the man cold is like, I'm going to bed. I'll be back in a week, like he's
Right.
checked out
Yeah.
and
And we
she's
can
still
have
running around him.
102 fever and throwing up, and we're like, it's fine. I just need a sip of Sprite. I'll make
Yeah,
it.
right. Suck
Let
it
me
up.
switch the laundry. Let me fix dinner. Like it's just
Yeah,
wild. But I
yeah,
think it goes to it's a greater issue there that like it happened
Mhm.
to me, it happened to you about it was just to be okay that we had this
right.
loss, right? Or it was just to
Yeah,
be expected or for these traumas to happen to you. My miscarriage was very traumatic to me. I'm sure losses for you were. And then, the fact of the retained placenta, that could have been life threatening for you
Mhm.
well, and
easily.
I
And the
honestly
deep,
saved my own life because the second one, she quote, I think I got it all. It was, yeah, there's more to that story, but I will say this. I am the one who identified the pain and I brought myself back to the doctor. And that's really like at the end of the day, if you feel like you're being dismissed, people talk about medical gaslighting in general for
Mhm.
anything, whether you're a woman or a man or people in minority communities, LGBTQ community especially is a
Mhm.
problem because they
Yeah.
are already being judged for whatever, which is just disheartening because there should just be equal care. There should just be
Yeah.
equal, a doctor giving you that time, more than 18
Right.
minutes in a medical office to say,
Right.
what is the problem? So yeah, I mean, I think it's a problem to not only to assume that women are going to just be fine. You guys were built to make babies and built to have a
Mhm.
child. You can withstand pain, but we should also know when something isn't working and something is wrong.
Mhm.
I feel like,
It's
and
very
I think,
disproportionate, the expectations that are put
yeah,
on us
yeah,
to cope with pain, to cope with complications. And then it's one of those, well, you're going to be fine. Or you're being dramatic. Oh, it's your hormones. Well, maybe it is my hormones, but there's still something wrong.
yeah, yeah, exactly.
makes you feel like you're crazy,
It
right?
does,
Like,
because in some cases it's an invisible problem, right?
Mhm.
yeah,
Because it's not something that people can see. You don't need a band-aid. You're not
Right.
physically showing
Right.
anything besides, like I actually know of many women who had complications after delivery and ended up taking themselves back to the hospital within a few days because they had a
Mhm.
fever of 108. I'm like, why is this still happening? Because it's still an invisible problem. Like the doctors are saying, it's
Right.
fine. This is why we have a rise in maternal deaths. I mean, this is why it's
Right.
at an all-time high. And obviously, the African American community has a serious problem with this because
Yes.
there's bias and other problems that exist within our
Very
health.
disproportionate care.
It really is, yeah. And it's crazy because it's 2023 and we live in the United States. Like
Right.
we should all have equal access to care
Right.
regardless. And in addition to that, we shouldn't still be having this problem because I have care, like I was lucky. I basically almost died twice. So like, how many times does this have to happen for, there to be a change? And I think in order to make an impact, we all have to share our story and talk about what we've experienced so that other people not only, like I said, feel less alone, but also that we raise awareness on this problem because it's not going away. It's not going to just get fixed with one solution.
No. And I think that's a good point because, Asherman syndrome, why it is, you may be like, well, I've never heard that. But now we're knowing, okay, just from this conversation, hey, if I've had D&Cs, miscarriages, if I've had C-sections, if I've had uterine surgeries or uterine traumas, that is a term now we can go to our OBs and say, or our midwives, whoever, and say, listen, this is my history. What do we need to do for us to both be aware of this and be preventative and try to be ahead of the game here? I mean, that's the whole point of Previa, how we approach mental health is we want to be ahead of it. We want to tell you what's normal, what's not, what's common, what could happen, what these thoughts are so you would recognize it. So we're doing the same thing here because we hear a lot from our moms, and I'll never forget this. My mom said this. They said, Sarah, they don't even believe me when I say physical symptoms are wrong. Why would they believe me with my mental health? When I was like, oh my gosh, she hit the nail on the head because she was saying, I'm having this pain, or, this doesn't feel right. And the doctors were saying, look, your vitals are good. Your labs are good, right? Like you look
I can't identify the problem. But that goes back to the thought that if it's impacting your quality of life, if it's something that you in your gut and your body that it's wrong, then you need to push it. Maria Menounos is a perfect example. She recently went and had a serious surgery for her pancreatic cancer that they caught early. Fortunately, not everybody has access to the type of MRI that she had, and that does not, sort of replace any general appointments that you should be going to, in my opinion. But anyway, I think in general, yes, Asherman specifically, if you feel, for example, that you've had recurrent losses, and I think that the two kind of categories are if you're under age 35 and you've been trying to conceive and you're having losses, it's 12 months. So under 35 is the 12-month period. And then over the age of 35 and you're having losses is 6 months. So essentially for me, it was a year and I was over 35. And it took a year to be diagnosed. So I was well beyond that period of time. I know I'm shaking my head with you because I am not faulting my endocrinologist because he was in practice for 30 years and he said to me, I'm not retiring until we get you another baby. Like he's just this incredible man. However, I do wonder why it took so long to get diagnosed. And I do regret not speaking up earlier because I didn't know about Asherman's. I honestly just thought we would figure it out. They'll just keep giving me different protocols. We tried ERA. We tried all the different variations and medications. If you name a test, I did it. We went through it all. They could not figure it out. So then that is when he said, and I think this is the sign of a good doctor in any situation, is when he said, I need to send you to a specialist who can potentially help you more than I can. And delegating it to someone else, in my opinion, is absolutely the sign. Not only, in any situation medically, like the doctor should have ideally referred me earlier. But when he said, you've had 4 losses, we've literally thrown the kitchen sink at you. We cannot figure out what's happening. You've done all the things I know how to do, but I want to help you. So I'm going to send you to this specialist. So I think that is the point, is really just making sure you feel safe and supported with your medical provider. And like you said, if you feel dismissed or you feel like you have a physical symptom that you can't see, but you're feeling, say something.
Absolutely.
Yeah, advocacy. We talk about that a lot with our Previa moms. I say that to a lot of just young women in general about their health. My husband's like, you give these conversations to your babysitter sometimes. I'm like, yes, because no one told me. And I wish someone would have said that to 18-year-old Sarah. Like, listen, you're going to have to fight for yourself, and you're going to have to listen to your
I've learned that.
body, and you're going to have
Yeah.
to speak up. And like, if you don't feel it's right, you find someone who will listen. And I'm very instinctual. I think moms are, and I think that's just how we're
Yeah,
made.
that's
And
true.
to follow your gut, and you deserve to have good quality care. You deserve to not be in pain. You
Yeah.
deserve to have what you want out of this life. And if that's just a reminder of that, and it's okay to have a different opinion. Like, it is
Yeah.
totally fine to
Yeah.
say, this is not serving me, or I'm not being heard. And you can even
Yeah.
have that conversation at first is, hi, Dr. So and so, this is my concern. This
Yeah.
is what I've been feeling. This is how long. And if they dismiss it, say, I don't believe this relationship is going to work because I'm not being heard.
Yeah.
I'd like to be referred. And you can always
Mhm.
go patient advocate. You can go to the manager of the
Mhm.
office. You can, for our Medicaid moms, I know sometimes we're talking to them and they just feel like, well, it's hard to find a doctor who even takes Medicaid right now. It's like,
Yeah, that's
well,
true.
they actually have patient care coordinators that you can call and say,
Oh, okay.
listen, this provider was not listening to me, and they will help you
Mhm.
find another provider. It is hard, especially in our
Yeah.
state in Alabama. We have maternity deserts. Some of our moms drive 2 hours one way for OB care.
Well, and two of the
And
hospitals here in Birmingham just shut down their L&D units this week.
so I
Mhm.
do think it's interesting, and we
Terrible.
see this every day with our moms, is like there is not care in some parts of
Yeah.
the states, and especially in Alabama. Like, literally there is not care, and you're driving. And so maybe you've drove 2 hours, and that person you see,
Yeah.
you kind of feel like, well, who else am I going to see?
That's so
So
scary.
it's
There's an incredible organization I highly recommend you guys check out if you're not familiar. Every Mother Counts. Are you guys
oh
aware of
yes,
I've
that?
heard of it, but I
yeah.
Okay.
don't know
So
all
it
the
was
ins
started
and outs.
by Christy Turlington. She actually had a traumatic birth. She almost died at birth. Also, I don't think it was retained placenta. I want to say it was like an abruption, but she basically hemorrhaged, the same situation that happened to me and so many other women. But she decided something had to be done because this happened in the United States, and this is happening. I think it's, I don't want to get the statistic incorrect, but there's hundreds of women
Mhm.
dying a year in the United States, and it's just debilitating because we're still in this situation. So anyway, there's an organization, and
Mhm.
they basically provide access to care to people who may not. So it may be worth,
Good.
looking into that. This is not
Right.
just
Yeah,
internationally. I think they also
yeah.
help in the US as well. But yeah, I mean, speak up and ask what your options are at work too. Maybe
Mhm.
they could help with something like that, access to
No,
care.
I think if anything, this
Mhm.
message is you deserve it to speak up, follow your
Yeah,
gut, advocate for yourself. And then, Lisa,
yeah,
we asked this question to all our guests. We've had every answer known to mankind. So this is like, don't feel like we have to talk, specifically advocacy or, oh man, I wish I'd done that. What do you wish you would have known about motherhood before you were a mom? Like, if you go back and say something to Lisa
yeah.
pre-babies, what would you tell her?
It's a great question. I would say you're doing a great job. Wherever you are is okay. I feel like
Mhm.
prior to motherhood, I feel like I didn't have that level of confidence in myself and like whatever I was doing in my life. And as a mom now, I feel like I could also use that advice sometimes. We give great advice to other people, but we don't
Mhm.
necessarily take it ourselves. I think we are,
Mhm.
in general, our own worst critics. I feel like this goes for everything in life, but especially for motherhood, like that mom guilt that sits with you. I feel like prior to becoming a
Mhm.
mom, I think I was also that way. I'm a little bit of a perfectionist when it comes to everything, but really the bottom line is there's no such
That's
thing as
us.
perfect. There really isn't, because you can just do the best that you can, and whatever you did is enough. I believe that with my whole heart as a mom and as a woman. Yeah.
Well, we are so thankful that you are using what happened to you as a platform to help other moms to come. And we really believe in sharing is the key for strength and empowerment. And that is our whole goal here at the podcast, is to say
Mhm.
it so you feel like you're not alone. And we don't believe anybody else is going to bring certain topics to you but us. So we
Yeah.
try to be that safe space. So we appreciate your
Mhm.
support, and just
Absolutely.
know that moms can look you up and follow you. We'll tag everything
Thank you.
because you put out great work. And it's really, I hate that trauma and infertility brings so many people into like the Me Too club or like this
Yeah.
community, but we heal together and we process
Mhm.
together.
Yeah.
And again, I really think it's just strength in knowing we're not alone.
Yeah,
Absolutely.
absolutely. I agree with you. Thank you so much for everything that you do for your community, because I think it's critical to start the conversation. Even if you think that your voice doesn't matter, your story matters, your words matter. And I think we're all listening. So thank you for everything that you say.
Well, it's our honor. So we will be back next week. But Lisa, again, thank you. And we hope this episode just lets you guys know you're powerful. Okay. You
Absolutely.
got a good voice. Use that voice and speak up. We will be back for our next episode next week. Till next time. Thank you guys.
See ya.
Maternal mental health is as important as physical health. The Previa Alliance podcast was created for and by moms dealing with postpartum depression and all its variables like anxiety, anger, and even apathy. Hosted by CEO, founder Sarah Parkhurst and licensed clinical social worker Whitney Gay, each episode focuses on specific issues relevant to pregnancy and postpartum. Join us and hear how other moms have overcome mental health challenges, as well as access tips and suggestions on dealing with your own challenges as moms. You can also browse our podcast library and listen to previous episodes at any time. Please know you're not alone on this journey. We're here to help.